I'm joined by Andrew Belyea, who is a researcher, a medical student, and has researched the Spanish flu. So it's like 100 years ago, and it's like, here we go again. We're back into a pandemic. There were some differences, though. One of the symptoms were a little bit different with Spanish flu than they were with COVID.
Many of them are actually fairly similar.
Okay.
The classic fever, cough, myalgias, which are muscle aches. They're pretty standard. A lot of flus, despite the strain, have similar presentations. Yeah.
I kind of remember nosebleeds, ear bleeds.
Yeah, I mean that can happen with many different things. Those weren't the hallmark symptoms, though.
Okay.
Yeah.
And the other thing was the demographics were different. This time around, it seems to affect an older generation, but it was young people that seemed to be the hardest hit during the time of the Spanish flu.
Yeah, normally during influenza with your kind of annual flu, there's a classic U-shaped distribution. If you can picture a U, you have young and old being affected mostly by it. The Spanish flu was unique because it was a W-shaped distribution, where the young and the old were still very much affected, but it was actually healthy people in their 20s to 40s who comprised the bulk of morbidity and mortality.
Yeah.
And that's different than what we see on a normal year-to-year basis.
And that part, did they ever figure out why that was? What there was that you'd think you're in the prime of your life, that you should be able to throw off something like even something as serious as the flu?
Yeah, so there are a few different theories. One is that many soldiers who were recovering from injuries from the war already had compromised immune systems, and then you throw on the flu on top of that, and that would have been more difficult to recover from. But the other thing is that they call it a cytokine storm, which has been investigated for COVID too. Essentially, it's your immune system going into overdrive. And so because you're young and healthy, that's probably the prime of your immune system's life is in that time frame. And so it's an overreaction to the virus, and that ended up killing many people.
Oh, wow. Now, one thing we should clear up is Spanish flu was not a good name for it because it didn't start in Spain. Where did it start?
There are many different theories as to where it started, and there's a lot of finger pointing because no one wants to take the blame. That's why it got the name Spanish flu, is because the Spanish during World War I didn't side either way. They were a neutral country, and so when reports from Germany and from England were coming out, they were trying to keep them hush, and Spain said, this is what's going on in our country. We don't care about seeming weak or strong for any enemy. And so it quickly became associated with Spain because it seemed as though their rates were much higher than elsewhere.
But the fact was that's not where it started, and a lot points to Kansas.
Yeah, Camp Funston.
Yeah.
It was a military camp where those were the first American cases, and so they thought that maybe it was in Kansas that it started. There's also an interesting theory that it started in China. If we look at Chinese pig farms, people who worked on pig farms, the thought is that potentially it may have come from there too. There was a smaller Chinese influenza in 1917, 1916, so a few years before. The idea with vaccines is if you get exposure early, you can often handle the virus, less morbidity, less mortality. And so the Chinese during 1918, when the Spanish flu did come, they had lower rates of death. And the thought is that maybe they had been exposed to this a few years before.
Okay, yeah, it starts to make sense when you think about it.
Yeah.
Now, Kingston, we're pretty smug about our good numbers with COVID, and we haven't had any fatalities. But that wasn't the case with the Spanish flu, was it?
Yeah, the Spanish flu in Kingston is a really interesting story, especially when you look back historically and you try and piece things together. There was the provincial medical health officer at the time. His name was Dr. McCullough. In 1919, he publishes this article in the Canadian Medical Association Journal, which essentially is a summary of what happened in some of the major cities in Ontario and how it compared to other cities. And Kingston had the highest death rate per 100,000 people, as compared to Toronto, Montreal, Ottawa, some of these other bigger cities where you'd think tighter conditions, they would have had worse outcomes. But when I was doing my research and I came across this number, it made me think, why Kingston? What is it about Kingston that gave it such a high mortality rate? And my theory is that it's a combination of free medical care, the fact that there was a relationship between Queen's and KGH at the time, and Hotel Dieu, where students could go and learn and benefit with their education from being on the wards. At the same time, the patients would benefit because they wouldn't have to pay as much.
So people came from all over to
Yeah.
come to Kingston. So they weren't necessarily Kingstonians who died. It would have been people from all kinds. They would have come from miles away, I would think, for free health care.
Yeah. Their estimates are that about half of people came from within 25 miles of Kingston. So not a huge range, but when I was doing my research, you see people all the way from Ottawa. There was actually someone who I can only assume was visiting family out from Chicago and from Saskatchewan, but the majority of cases were kind of east of Oshawa, Smiths Falls, Perth, even coming down.
Yeah. Now, tell me about volunteers during this time.
Sure, yeah. Volunteers played a really integral role in the kind of local effort. There was the Ontario Emergency Health Volunteer Auxiliary, is what they called themselves. And this was a group of effectively nurses who organized, mostly women, to make food deliveries, provide nursing care. And it was essentially like a 5-day crash course on how to be a nurse. And so if you were willing and able, a lay person in the public, not medically affiliated, you could sign up to do this course, and they would teach you how to care for people, and you would go out and serve the community. And so there was quite a strong contingent here in Kingston of women who did that.
That just amazes me, considering the risk that was involved. And then they graduated medical students early so they could work on the pandemic.
Mm-hmm. Yeah, at the time, medical education was a 5-year degree. Nowadays, it's 4 years. But the 5th year, the Queen's students were given kind of accelerated graduation. So they were given their degree early and asked to go out and help. Many of them stayed local. Many of them went to surrounding cities and helped out there.
Did we have the economic conditions the same? Were there shutdowns of businesses, shutdowns of schools, churches, all the things that we're going through now? Did that happen?
There was a really interesting kind of case study in particular on that in Kingston. So of course, the Spanish flu started really in the early days of October, and lasted for several years around the world in different waves. But really in Kingston, it was isolated October, November, and then a little blip in February too. So by the time a lot of these shutdowns happened, things were actually recovering quite quickly. Looking at the historical newspaper reports, there's really not much mention of the Spanish flu by mid-November. Starting in early October, it's about a month and a half by the time it kind of disappears. And the one major economic discussion that goes on in the papers is about the Grand Theatre on Princess Street. Because schools were forced to close down, churches were forced to close down, some of these bigger institutions. But pool rooms, barbershops, the smaller ones, they weren't forced to close down. So of course, as a privately owned business, the Grand Theatre put up quite a fuss because they were forced to close down, and they pointed to all these other businesses that weren't forced to. They said, we've got great ventilation, we are far superior to many of the other businesses, why us? And so that was the major shutdown. But actually, no, unlike COVID, it wasn't kind of an all-out shutdown except for essential businesses.
The other thing that's become part of our life is wearing a mask. So did people wear masks?
So that was dating back to the bubonic plague in the 1300s. There was this thought of wearing masks to protect ourselves from whatever the badness is. At different times in history, there have been different theories about what that actual badness is. So it kind of stemmed from that, and it's more common in Western Canada. In the city of Edmonton, they were forced to wear masks out in public, and then it eventually spread to all of Alberta. But that was never made mandatory here in Kingston.
Never a thing.
No.
Right. Now, you mentioned that eventually it just, what did happen? How did it end?
So that's a good question. Just as we're seeing with COVID right now, it will come and go in waves. And so as with Spanish flu, same with COVID, there was an initial first wave, quite a lot of panic surrounding that, and the second wave was much longer and worse, more drawn out, because those people who aren't huddled away, you can only do that for so long. And the strain mutates and changes and affects, the symptoms can start to change. And so it really did kind of go through this slow, drawn-out second phase in the winter of 1919, and then eventually kind of petered out with a small blip in the spring of 1920.
Okay.
Yeah, and no major change, as we will likely see with COVID. It'll just slowly, the admission rates and death rates will just start to drop.
And it just went away.
Yeah.
Yeah. So we've only got a couple of minutes left, and I'll ask you a 10-minute question to answer in 2 minutes, and that is, what did we learn from the Spanish flu, and what did we learn that we can apply to COVID?
The big thing that we learned from the Spanish flu, particularly in Canada, was we needed a united effort for approaching major national health problems. There was no Department of Health, there was no national unified strategy, and so every city was really paying attention to the provincial guidance at the time. And that was one of the last straws, the Spanish flu, where physicians were fed up, policymakers were forced essentially to create this Department of Health, which eventually became the national healthcare system we know as of today. In terms of how can we apply things to COVID, I think we recognize that that things don't go away quickly. Kingston's actually a bad example of the Spanish flu in that it came and went in about a month. You can stretch that to 4 months maybe in the winter of December through February of 1919. But this is going to take a long time, and people ask why haven't we learned more? And the reality is that we as humans haven't changed much in 100 years. And so when we're faced with new unknowns, particularly regarding our health, we have better tools certainly to deal with these things. But we still have to deal with all the policy things, and that once you start involving policy and human behavior and what people want, we haven't changed much. And so people want to avoid the shutdowns, and that kind of makes things difficult when you're working with trying to develop a national strategy. Which
is what we need, and I hope it's over soon.
I hope so too.
I think we all do. It's it's getting old.
Mm-hmm.
This has been so interesting. Thank you so much for being here today.
You're welcome. Thanks for having me.